Hi, my name is Dr. Sam Sunshine. I'm a family and sports medicine doctor here in Southern California. My office is OC Sports and Wellness located in Foothill Ranch, California. Today, I'm going to talk to you about the signs and symptoms of the common cold and how you can treat it. So it's wintertime here in Southern California, and by far the most common thing we see is the common cold. Typical early symptoms of a common cold are a scratchy throat, body aches, headaches, fevers, chills, muscle aches. And this is our body's response to an invading virus, which are the most common cause of these common colds. And it gets us to relax and rest and slow down. And then the common cold typically transforms into some nasal congestion, runny nose, and then chest congestion. Most colds will last about 7 to 10 days, and really they don't need it much except rest and hydration and slowing down. I oftentimes advocate that you don't work out vigorously during the first week of a cold, and gradually get back in your exercise regimen once you feel like the bulk of the cold has gone past. It seems that on the 5th day symptoms worsen. That's when most people come in to see me. They want to know what can be done for their symptoms because they're kind of fed up and tired of being sick. And I kind of encourage them to stay hydrated, to get maybe 1 or 2 more hours of rest than they normally do, and to slow down. Most people will be better by 7 to 10 days. What do I do when the initial symptoms come on? I've got a couple remedies that I use that I was going to share with you today. I'm not endorsing any one product or any company. The first thing I recommend is zinc lozenges. Studies have shown clinically to improve the severity and duration of symptoms that started within the first 24 hours of a cold. The ingredient you want to look for is zinc gluconium, and again, you can find them in any pharmacy or supermarket. They're pretty easy to get a hold of. The one brand name is called Cold Ease. That's one that was studied. The other thing that can be done is oscillococcinum, primarily for flu-like symptoms, but those are these little white pellets that come in these vials, and those also need to be started in the first 24 hours. Other things that I like during the early phase of cold, green tea. Green tea is good because the steam alone can be very helpful to kind of open up the nasal passageways. And there's antioxidants, catechins within green teas that seem to help bolster the immune system. Other things I like early on, ibuprofen. Simple ibuprofen or Motrin gel caps can be very easily taken. Don't have too many side effects as long as you're not allergic to aspirin or anti-inflammatory products. They can help relieve symptoms of headache, body aches, fevers, chills. Another thing I have here that I oftentimes will use are these effervescent tablets. Another name is the Alka-Seltzer Plus Cold Medicine. They've got a combination of a pain reliever, decongestant, and an antihistamine. And that combination seems to help get people through the day. It's not to be used at night. It doesn't have a sleeping aid, but it can be very effective. At night, there's always NyQuil. NyQuil is something that, again, is over the counter. It's got an antihistamine, pain reliever or fever reducer, and also a sleep aid that can help you sleep. And again, sleep is the most important thing that you can do while you're fighting off a cold. Lastly, I also like Emergen-C. Again, I'm not endorsing any one product, but just getting those effervescent crystals, something you can take that has vitamin C or that's high in antioxidants, can be very effective. I'm currently fighting off a cold myself, and again, I encourage patients not to ask their doctor for antibiotics in that first 7 to 10 day window, unless of course you think you might have strep throat. Antibiotics have never been shown in any clinical trials to be of any value in terms of shortening the duration or severity of your symptoms. And in fact, there's about 140,000 visits to the ER for side effects to antibiotics. So I really encourage patients to do the best they can, take over-the-counter cold remedies, and if you start them early and get plenty of rest and hydration, these colds should be really no big deal. Thanks so much for listening.